We're presenting on hypertension in children. Our target audience is the parents of children with hypertension. My name is Dylan.
I'm Kelly.
I'm Holly.
I'm Ellyse.
I'm Desmond.
More than 72 million Americans in the United States have high blood pressure. In order to understand this better, let's talk about exactly what blood pressure is. Your heart pumps blood through tubes in your body called arteries and veins. The physical pressure caused by this action is called blood pressure. When we check our blood pressure, we are measuring how hard our heart is having to work in order to move that blood. Blood pressure that is too high is called hypertension. It can be harmful to the body. Blood pressure can be measured with a blood pressure cuff or a stethoscope by a nurse or other healthcare professional. Two numbers are looked at when measuring blood pressure. The first is the systolic pressure, which is the highest number and refers to the pressure inside the artery when the heart contracts and pumps the blood through your body. The lower number is the diastolic pressure, which refers to the pressure inside the artery when a heart is at rest. Both the systolic and diastolic pressures are measured as millimeters of mercury and represents how high the mercury column is raised by the blood pressure. Hypertension can cause all kinds of problems, which we will discuss in more detail later. It is extremely important to address the issue of hypertension because if your child has hypertension, they will likely have it as an adult as well.
In children, the blood pressure is defined as blood pressure greater than the 95th percentile for their age, height, and gender. In a 1-year-old girl at the 50th percentile, it should have a blood pressure of 104/58. A 1-year-old boy at the 50th percentile should have a BP of 103/56. Some of the statistics are kids are less active now, and a 1996 issue of Task Force provides further details regarding diagnosis and treatments of hypertension in infants and children. Hypertension is becoming more common in children today. According to the CDC, 16% of children and adolescents ages 6 to 19 years old were overweight between the years of 1999 to 2002.
Blood pressure always changes and is affected by physical activity, rest, body temperature, diet, emotional state, posture, and medications. The most common causes of hypertension in children and teens are heredity and being overweight. Babies who are born premature have a higher risk for hypertension. The younger the child is, the more likely it is linked to some other illness. Some of the illnesses include kidney diseases, disorders of the endocrine system, or blood vessel abnormalities. As a child gets older, the causes of hypertension are more likely linked to excess weight from lack of exercise, poor nutrition, and stress. Some medications have also been shown to cause hypertension in teens, such as steroids, oral contraceptives, and overconsumption of alcohol and illegal drugs. Race, sex, and age do not have very significant differences in the causes of hypertension.
The long-term consequences of hypertension. Most complications from high blood pressure relates to the circulatory system. The heart and arteries have a much heavier workload due to the added strain the circulatory system encounters with hypertension. Over a long period of time, with the heart overworking, the heart and arteries may no longer work as well as they should. Other organs that receive blood, such as the brain and kidneys, will also be affected, and that's why there's a chance of kidney failure and strokes. With hypertension, you are at greater risk for stroke, heart attack, kidney failure or disease, loss of vision, and hardening of the arteries. Stroke is when plaque breaks off in an artery or blood vessel ruptures, and the blood clot forms, and if the blood is blocked to the brain, it causes a stroke. A heart attack is when plaque breaks off in the artery or a blood vessel ruptures, and the blood clot forms and blocks the blood from entering the heart, which causes a heart attack. Kidney failure or disease affects small blood vessels, which affect their ability to excrete waste properly. Loss of vision is when capillaries in the retina are damaged, which lead to a decrease of oxygen to the eye tissue. Hardening of the arteries is when there is added stress on the arteries and the plaque can build up. The arteries become narrower, and this limits or blocks the flow of blood to the heart muscle, which deprives oxygen to the heart. These consequences are severe and life-threatening, which is why knowing if your child has hypertension is important.
Hypertension is highly preventable and treatable. First off, we should just calm down because anger spikes your blood pressure and due to your body's fight or flight response. Your brain cannot tell the difference from someone being annoying or your life being in danger, so it acts the same way for both. Also, in America, overconsumption of sodium is also a primary culprit of hypertension. 1 teaspoon is recommended daily. That's not tablespoon, that's a small one. That has approximately 2,325 milligrams of sodium. The average American consumes 3,400 milligrams of sodium per day. That's 33% more than the daily recommendation. Sodium is heavily present in processed foods, and they are often hidden because you can't taste them. Taste the salt. You don't taste half a serving of salt in those canned green beans, but its presence won't be missed by your child's heart and blood pressure. I don't think I even need to speak on the fast food restaurants because we've seen them dump the pile of salt right on top of the fries, and we consume them like like it's nothing. As far as healthy foods, we should eat the rainbow. I'm not talking about Skittles. I'm talking about a variety of foods, mainly fruits and vegetables, to limit overconsumption of just one thing. This will help with many types of chronic diseases. Get your child to drink as much water as possible because it is the avenue by which waste is dispelled from the body for the most part. So any excesses or any bad things, toxins, are released through your urine, mostly, from your body. Also, exercise. What does sweat taste like? Salt. How do we sweat? We plan exercise. Not to mention exercise also lowers your child's resting heart rate and makes the heart work less hard when it's not working, when it's not supposed to be working. And there are simple and affordable monitoring devices. This is a home use blood pressure monitor. You just stick it on your wrist and you press start. And as you can hear right now, it's choking off my blood circulation to my hand. Continuing to do so. It might be high because I'm doing a presentation. Don't judge me. It should take around 60 seconds. It's already started, so more like 40, 35, 30, 25, 20, 15. Awkward. 10, 9.
You're pretty close.
Yeah, I was pretty close. It's not good, but I told you that. Don't judge me.
What is it?
It's 173 over 105, and that is because my body can't tell that I'm just doing a presentation. It thinks I'm getting mauled by badgers or something. I don't know.